This is Herman Richter. It's 9:30, and class is in session.
Good morning. Every Tuesday, we get a chance to catch up with Lakes Regional Healthcare. We have Brad in the studio. Welcome back, sir.
Thank you very much. Good to be here.
Good to see you again.
Likewise.
Lots of good things going on in your world. New rehab services.
Excellent.
Lots of construction.
It's awesome.
All sorts of fun stuff.
That's right. I can't believe we've been here a year already. We started in October of 2010. Just with 2 physical therapists and 1 occupational therapist, and of course our 2 wonderful waiting and tech staff, and we've grown already into 3 doctors of physical therapy, 2 licensed physical therapy assistants, the same occupational therapy with another one on the way. So lots of neat things happening in the new department and with our staff.
Are you blown away?
I'm blown away.
Because we're talking about really a year.
Right.
1 year, one full year.
How quickly things happen. Yep.
No doubt.
Yep.
And when you see a staff that size in a community our size.
Yep. It's pretty neat. And it's staff from different backgrounds, different educations who are bringing neat things, neat ideas in rehab to our team. So that's pretty neat.
And Brad, I'm sure you've done some research. Other communities our size, they don't typically get a staff like this. So we are very fortunate.
Not this quickly. You don't. Sometimes you recruit that high school student who they know they want to go into medicine, and you talk to them, and it just seems like forever. And then after we go to school for 7 years and they come back and you luck out and along the way they really want to come back to the area, and sometimes you lose them because they head off to the city. But we're very lucky to get this group. What
do you think the attraction to the area is? Besides the obvious and the lakes and all that, what do you think the attraction is to recruit these people back to Lakes Regional Healthcare?
The innovative team at Lakes Regional. I mean, they're willing to build and grow and provide resources to get equipment to stay cutting edge, to really, they've made a commitment to do the very best we can in rehab.
Let's talk about the new department a little bit. You've got the southeast corner by Northwest Iowa Boynton Joint.
Yep. Same entrance in that southeast corner. It's curbside parking, easy to get in there. We've designed it such that it's a lot more private. So you walk in, the gym space isn't quite as big as what you would be used to in a typical rehab setting, just because we're starting to work more with the Y. We want to use that gym and use our space to be more private, where you come in, the whole neighborhood isn't knowing what's going on, kind of thing.
I was going to say, that's pretty important to people too. And a lot of people think that's secondary, but it's really not. You do like your privacy.
More and more. Yep.
So, and,
right.
Again, and it's nice that you guys were conscious enough to notice that and take advantage of that and make it happen. Yep. So I'll tell you what, a quick break. We'll come back and chat more. Does that sound good?
Sounds great.
All right. Brad's hanging out with us here on Get Up and Go University. Lakes Regional Healthcare, our guests. We're coming back right after Lady Antebellum here on Campus Radio. 38 degrees out there. Good morning. Lady Antebellum, I need you now. It's 9:37, 38 degrees. We're in the middle of Get Up and Go University, chatting with Brad about the new rehab services at Lakes Regional Healthcare. If you're just joining us, lots of new things. We were talking about this great staff that you're able to have there. Let's kind of recap who you got now.
We've got 3 doctors of physical therapy. We have Jason Munden, myself, Brad Rohwer, and Sarah Wyatt. All with 7 years of college, have different backgrounds, different interests in patient care, shall we say. I've got 2 licensed physical therapy assistants who are excellent. One of those is a certified lymphedema therapist, and then Kathy Campbell, who is an occupational therapist with the Mayo Clinic background. And we are really recruiting hard to get another occupational therapist on board soon.
And from what you're describing, shouldn't be that challenging.
Shouldn't be that challenging.
You guys have done such a good job with recruitment, and you've always got your eye on the future and where you're going and where the rehab services are headed.
Thank you. Yes, we do. We're working really closely with being right across the hall from Northwest Iowa Bone and Joint. We've got other programs going, a sports medicine clinic on Saturdays for athletes. We have what we call joint camp for people who are undergoing total hip and total knee arthroplasty, total joint surgeries. We have an education program before, so you get to know your therapist. We do a lot of practicing training before the surgery. That makes that much easier, the rehab process, once the surgery is done. So all kinds of things happening.
We were talking off the air how important it is to know your therapist, and tell us the reasons why.
It's a scary process.
It really is, right?
Yeah, you're in pain or you've lost function. You're not sure what's going to happen. And the more you know your therapist, the more your therapist teaches you what's wrong, what's going to happen, sort of lays out timeframes of how the rehab process should go. It seems like the scariest thing is the unknown. So as soon as we can remove the unknown and become familiar, everything seems to fall into place.
Imagine there's a lot of trust on both the patient and the therapist.
Absolutely. And we're developing trust, even with the rest of the healthcare team, your family doctor, your orthopedic surgeon, wherever, your doctor, wherever you're referred from. And we've got people referred from all over. We like to communicate a lot with the doctor, the whole team, and so everybody knows what's going on. And
you work a lot with the area athletes. Of course, this area goes without saying is such sports enthusiasts.
That's right.
And it is something you guys really do over there. You do work with those young athletes. That's right,
more and more. Yep. And that's, like I talked a little bit about, we're developing relationships with a Y, using their pool, using their equipment along with ours, so you get more advanced, for that athlete who needs higher functional levels than we can do in a hospital type setting.
Got to send a shout out to Norm and the staff at the Bedell family.
Absolutely.
Yep. Again, we talk about how innovative Lakes Regional Healthcare is, but when you think of Norm and his staff at the Y, again, he's just somebody, he sees a void, he goes after it, he likes to partner with area businesses, and it's just, he's always putting his best foot forward and always looking out for the community. So I'm glad to see that you've got that partnership in place.
Absolutely. It's silly to even consider competing when, they have a lot of things that we can use and they have things, back and forth. There again, to take that patient to the next level, we can use their pool and their equipment and their expertise. So,
well, at the end of the day, I'm glad to see that philosophy both with the Y and Lakes Regional. End of the day, it's all about the patient.
Absolutely. That's what we're here for.
And we've got these fantastic resources between the two, so it's really great to see.
Right.
So again, if folks want more information, they're also welcome to come take a tour, aren't they?
Anytime. Just stop in. We've got staff available to show you around, show you what we're up to, show you the new facility. We're very proud of it.
Somebody may be listening that knows somebody that's in this field that maybe would want to come to work for you. You are recruiting, right?
Send a resume.
Send the resume, right?
Right.
It's always good to see you. There's so much good news going on over there. Anything you can think of we might have missed that you want folks to know about?
I don't think so. I think that covers it. We're just really excited about all the new things happening.
Well, again, it's good to see you. lakeshealth.org is the website. Also very active on Facebook. All they have to do is look up Lakes Regional Healthcare. Is this a direct contact number then?
It is, yep.
336-8651. 336-8651 gets you right in to all the rehab services. Brad, always a pleasure, my friend.
Thank you very much.
You betcha.
The views, opinions, and show content of this Get Up and Go University sponsor are not necessarily those of Community First Broadcasting ownership, management, staff, or its advertisers.